Among the Sudanese war's many victims was Khalid Sanhouri. When he died of illness, he was buried here in front of his house in Omdurman, Sudan's second largest city. It was too dangerous to reach the graveyard. According to a report by researchers in Britain and Sudan, more than 61,000 people are estimated to have died in Khartoum state during the first 14 months of Sudan's devastating war, with deaths from starvation, disease, and the collapse of health services putting the toll at significantly higher than previously recorded. Sanhouri's neighbour, Mohammed Omar, said intensive fighting prevented them from getting medicine or help for him when he fell ill.
It is difficult for someone to be buried by the front door. His daughter still cannot come and see this scene. It is difficult. It is God's command, and we cannot say anything. But it is very painful.
War between the Army and Paramilitary Rapid Support Forces, or RSF, erupted in April 2023. Some bodies buried near homes are now being relocated to Omdurman's main cemetery. Undertaker Abdin Khedir says there are 50 burials a day. Graves have spread into an adjoining soccer field, and the bodies keep coming. The preprint study by the London School of Hygiene and Tropical Medicine's Sudan Research Group, released on Wednesday before peer review, found some 26,000 people suffered violent deaths in Khartoum state, which is more than the United Nations statistic for the whole country. Ahmed Mohammed helped dig these graves by a local soccer pitch. He recalls how RSF fighters stayed in his neighbourhood for 3 months and the locals were trapped.
Most of those people died because of disease and starvation. They could not find food, drink or medicine. The RSF fighters deprived us of everything. It was normal for them to deprive you of food and drink, or prevent you from leaving your home to get medical care.
Tallying the dead has been a challenge. Fighting cut people off from contact with the outside world and from hospitals, morgues and cemeteries where they could record deaths. Researchers used a sampling technique known as capture-recapture. They compiled 3 lists of the dead from different sources: social media surveys, community surveys, and deaths announced on social media. They found very little overlap between the lists, suggesting many deaths went undetected. In Khartoum Bahri, a city north of the capital, hospital manager Hadil Malik recalls a single week when 144 people died.
As we all know, malnutrition leads to weak immunity in general. This is one factor which leads to exacerbating epidemics, which leads to many deaths, especially among pregnant women and children, in addition to an increase of anemia levels. For us, one of the major side effects is severe anemia and fatigue, which leads to more side effects including heart failure and all other complications.
The warring sides have traded blame for the growing toll. The Health Ministry told Reuters that it has observed far fewer war-related deaths, with its tally standing at 5,565. The RSF did not dispute the study's estimates, but blamed the deaths in the capital on what it described as deliberate airstrikes on populated areas. The United Nations says the conflict has driven 11 million people from their homes and unleashed the world's biggest hunger crisis.